Greeting. It's been a minute since I've had a new video on this channel, but I thought it was time. I've been working on a healthcare revenue cycle training website. Basically, there's this software you can buy. You can turn what used to be a blog into a membership site, and that's what I'm doing. I had mentioned it back in October, but it's taken me all these months to get close to a point where I might be able to launch the site officially in another 4 to 5 weeks. One of those weird things is that I used to consider myself technically advanced. There's a lot of stuff I've known how to do over the years, but over those years, a lot of things have changed. So I got this software and I've been working on this site, and it turns out that creating the content for the site is less problematic than trying to get everything else working. But I've gotten to a point now where now I'm in a true testing mode, and if all goes well, I will be able to truly launch it. So let me talk about what it is. And I mentioned it way back in October, but now I can flesh it out a little bit more. In essence, I've been in healthcare 38 and a half years. I have been at a higher level for, well, we'll say 34, 33 years. I've been a consultant since 2001. I have got a lot of knowledge on healthcare revenue cycle issues. The reason that I am able to do a lot of things or know a lot of things that not everybody knows is because I started with a billing background. And that's very integral to everything that I've done, because it's not just billing, it's not just registration, but it's charge creation, it's coding, it's working with other departments, compliance. It's just a whole lot of things that I know. I'm not going to say that I'm the only one who knows this, but I am one of those people who believes that if you don't have a background in at least 70% of the things that I do or that I've done or that I talk about, then you're going to be somewhat behind everybody else. Doesn't mean you won't be effective at what it is you do, but it just means that you're not as well-rounded. It is my hope and intention that I can help more people become more well-rounded in healthcare revenue cycle. I mean, it needs to be done. I mean, over the past 20 years, and I have to actually kind of exclude the last 4 or 5 years because I was taking care of my mother, so I couldn't travel, but I still was writing about it and doing certain things here and there. But I think that when you see certain stories that show up on TV news, in the newspaper, or if you're working at a facility and you're wondering, why are some of these things that seem to be going on looking strange? There just seems something wrong about these things. Well, because truthfully, there's a lot of folks who are in positions of authority who don't know a lot about healthcare, finance. Sure, they may know the accounting part, but they don't know the rest of it. I'm not going to talk about it in this video, but I am going to talk about it on the website. So here's what I've done. I have created 4 articles that are totally free. Anyone who wants to go look at those articles can go look at those articles. If you look in the, what do you call that area? The profile area, where you put all the information in about what the website is. If you scroll down to the bottom, you will see just one link up from the last one is something that says https://blog.medicalbillinganswers.com. That will take you to the main page where it talks about what the site is going to be. Then you will see a link at the top in the menu that says articles. You click on that, you will have access to 4 articles on different topics, but they're all within healthcare finance. You can read those articles, you can learn something from them. I put those out there so that people who are ready to subscribe in some way later on will at least see the kind of things they're going to get. There's no access to comments because that's only going to be for members. But I think there's a lot of information there. I would bet, I hate to do it, but I will bet that 80 to 85% of the folks who see those first 4 articles are not going to know almost any of that. You may know 1 or 2 things, but I don't think you're going to know it in that depth. Not that I'm saying that anyone is stupid. I'm not saying that no one is qualified or capable. What I'm saying is that there was no one really to teach you these things for the most part. No one taught me. I just started to do things. As I moved up into different positions and before I decided to go out on my own, I just took over. I started doing a lot of those things on my own because I thought they needed to be done. It was more than just billing and registration and collections, which are the departments I was over. It was all of it because no one else was going to do it. I was one of those guys who wanted everything to be better than it was and made it better than it was. It sounds like bragging, but it's not bragging if you did it. And I'm not saying that I got everything perfect because, a lot of times it's a learning curve. You try something to see how it's going to work out. And if it works out, great. If it doesn't, but you haven't totally failed, then you can modify stuff. So I've learned a lot on that trail. And then as a consultant, I've learned a lot. Yes, I've walked in with a lot of information, a lot of knowledge, but you still have to learn different things. Sometimes you need to learn how to protect yourself if you're going to be an independent consultant, or even if you're in a position of a charge master coordinator, or truthfully, a billing person, whether you're the supervisor, director, or just billing, you need to learn how to protect yourself. Sounds scary, but healthcare is one of those areas where there's a lot of regulations you have to learn and you should at least know about, because when it comes to something like fraud, the Office of Inspector General and anybody else is not going to accept, well, I was told by my supervisor to do this, if something was egregious, and let you off. Ain't gonna happen. People will tell you that it will, but it's not how it works. Anyway, I just wanted to put this out there. Encourage you guys to go take a look at these 4 articles. Like I said, that's all you're going to be able to see right now. At the bottom, actually, when you get to the first page, you will see the write-up of everything, that the site talks about. It's got an email address if you want to send me an email about any questions that you have regarding the content for the website. But until I'm ready to launch, there's no link for anyone to be able to sign up or join the site. That's just kind of how it has to be. But I'm trying to see if anyone is interested in coming to check it out and signing up for it. And I'm not going to say anything more about it. Read what you want to on the website instead of me talking about it all. But probably within at least another 3 weeks or so, I might be able to mention a little bit more that is not written on the main page you're going to show up at first. Anyway, my name is Mitch Mitchell, and I hope to see or hear from y'all at some point. You take care.